Okay, so various hormones act by the different ways of receptor. So when we talk about the membrane receptors, we have the various pathway like CAMP, CGMP, IP3DAG. Okay, so all this act by, even your peptide hormones like insulin like growth factors, they all act through the membrane receptors. When we have steroid hormones, thyroid hormones, basically they can act in the nuclear receptors. Then similar way, you can see this type of tyrosine kinase receptors, actually these are all membrane receptors. Even G coupled protein receptors are membrane receptors. Okay, so rarely you can get question on this, but this is, I've just added to make you a little oriented. Then this is the commonest presentation you will get in any endocrinology discussion. Patient will be obese, hirsutism, androgenic alopecia. So probably this is indicating insulin resistance, and you have to think about the diabetes or metabolic syndrome. Okay, so this is about the insulin resistance. Now let's start with the pituitary first. So this was just the orientation. Now whenever a patient of the pituitary disease comes to you, most of the times he will have the various symptoms of the pituitary. Suppose it's hypopituitarism, right? Then growth hormone, TSH, all the symptoms, all the glands functions basically will be reduced, and all the hormones will be reduced. So if it's affecting growth hormone, growth of the patient will be reduced. Even sugar control, or patient may have hypoglycemia because of this. We know there is a function of IGF. Then if it is associated with thyroid, then you know TSH is low, so you will have secondary type of hyperthyroidism in these patients. Okay, then various like FSLSH function will be this, that causes the patient to develop the loss of libido, etc. Secondary sexual character will be poorly developed in this patient. Okay, so pituitary adenoma itself can be one of the thing. So now let's see in this patient actually presented with visual field defect. We did the MRI for that, and you can see there is microadenoma over there in the pituitary, and that typically macroadenoma causes the reduction in the secretion of the pituitary gland. All right, so your ACTH, GH, prolactin will be reduced in this patient. So that's about the hypopituitarism. Now let's see various diseases associated with it. Okay, so first of all, we have this type of there. You can see this patient presented with fatigue, amenorrhea, hypotension was there, ACTH stimulation, cortisol levels tests were done. Okay, so as you can see over here, again this is one more hypopituitarism basically caused by the macroadenoma, and this macroadenoma basically compressing the pituitary gland. Okay, this is the macroadenoma, this is the normal one, this is the macro. Okay, and this is the microadenoma. Okay, of the pituitary. So basically this will compress the pituitary, reducing all the function. That's why you can see fatigue, amenorrhea because of the TSH is low, amenorrhea is because of FSLS is low, hypertension is because of the your other hormones basically that is reduced, mostly cortisol, etc., ACTH. Right. So based on this, we have various tests actually for hypopituitarism. We can check growth hormone by the insulin tolerance test, JNRS test, L-arginine test, L-dopa test. I know you might have read that in the endocrinology. So it's just a revision. Then prolactin, TRH test, ACTH, we have insulin tolerance test, CRH test, metaropone test, right? In which we give this metaropone 30 mg per kg in the patient, and we check the cortisol level. Okay. Yes. Then similarly, ACTH stimulation test, low dose ACTH stimulation. Then even TSH can be checked by the basal thyroid function test, FP3, FP4, and TSH level mostly done in fasting state. Then LH, okay, and multiple other hormones can be checked to calculate the patient has hypothyroidism or not.